For me, aesthetic and beauty has been always a part of my life. Because since I was a young child, yes, I grew up in a family where beauty and aesthetic was very important. Patients, persons are exposed to a lot of pressure. Pressure from the social media, pressure from friends, pressure from the society to look good, to look up to perfection. I don't like to put too many before and after photos because I strongly believe that I'm not representing a product, but I give education, I give information. I have to listen to the patient, let the patient talk, and for me to understand exactly what the patient wants, what is the expectation, what is good for her or him.
So, how to identify and how to differentiate to whom to go, how to approach and see what is good or bad?
If you take a shortcut, okay, then you may have problems.
And these are qualified doctors or...
See, that is also a good question because...
In a world chasing success, we chose to slow down, listen and re-engineer from within. After 2 documentaries and 40 plus powerful stories that moved hearts worldwide, this is the Re-Engineered Club. Everyday people chose to change the way they look. But are they really changing their appearance? Or are they just searching for confidence, acceptance, and a new beginning? Welcome to the Re-Engineered Club. I'm your host Madhusmita Nayak, and this is where we uncover the stories behind transformation. And today's guest has spent more than 3 decades helping people on that journey. An international renowned specialist plastic surgeon, educator, and pioneer in aesthetic industry. He has transformed thousands of lives by building in confidence. At the same time, witnessing the powerful connection between appearance and human psychology with self-confidence. Today, we'll explore the science, psychology, and this purpose behind this aesthetic medicine and industry. Please join me in welcoming Dr. Roberto Viel to our Re-Engineered Club. Dr. Roberto, welcome to our show, and it's a pleasure having you.
Thank you. Thank you very much for inviting me, and I'm ready to share my experience with you.
Dr. Roberto, before we start, can you tell where you started, where you work, and where our audience can reach you out?
Yeah. I'm Dr. Roberto Viel. I'm a plastic surgeon, originally from Italy. I'm Italian, but I did my study at Milan University, where I did my specialization and I started my career. But then I moved to London. I moved to London in 1991, where I started with my practice in aesthetic plastic surgery in Harley Street. And after more than 30 years, I'm still working in London, in Harley Street. And in 2008, I moved also to Dubai, where I opened my clinic in Dubai. And since then, I live here in Dubai. I'm a resident here in Dubai. I work here in Dubai, but every month I commute back to London because I kept my practice there. So my way of living and working is sharing my time between Dubai and London, with the team in London, the team here in Dubai, to serve my patients and to give my expertise to my patients. And here in Dubai, I am in Kutaina Specialized Hospital for aesthetic plastic surgery. And in London, I'm in Harley Street. And so that's my life, and to serve my patients between Dubai and London.
You are indeed a global citizen, and saying that, how our audience can reach you out in social media?
Social media is important. They can see my Instagram account where I put all information about what I do. I don't like to put too many before and after photos because I strongly believe that I'm not representing a product, but I give education, I give information because I want the patient to be well informed. And if you're interested, you can come and see me to have a proper face-to-face consultation. And that will be the moment where I can show you the before and after photos and we can discuss that. Because it's not like to open a catalog of product or cars or dresses that you want to choose. No, this is different.
Yeah.
Consultation is the moment where you can have the feeling with the doctor and you can see the before and after photo.
And definitely the first interaction, and that's a platform where you get a chance to listen to the story.
Yes, correct.
And you have almost 3 decades of experience in this industry,
Yes.
dealing with beauty, which is a very important thing in today's world. Before we deep dive into aesthetic, beauty, psychology, I'll just start with simple definition. What is aesthetic?
That's a very good question, and for me, aesthetic and beauty has been always a part of my life. Because since I was a young child, yes, I grew up in a family where beauty and aesthetic was very important. My mother passed me that sense of beauty, aesthetic to me, and so has been always with me. So for me, aesthetic is to appreciate the beauty in everything, the beauty in nature, the beauty in person, the beauty also when things looks bad, but there is always something to learn and to appreciate.
Brilliant. And when you say beauty in adversity also, right? When something goes wrong and we see that.
Yeah.
But actually, does it happen in today's aesthetic industry where people are craving for beauty? And what is the psychology behind that?
Okay, nowadays persons are exposed to a lot of pressure. Pressure from the social media, pressure from friends, pressure from the society to look good, to look up to perfection. And sometimes that's put too much psychological pressure on the person, and they may go in the wrong direction in a way that they don't understand anymore exactly what is the real beauty and what is an exaggeration.
Yeah.
So that's why I think that we, as a professional, honest professional, we need to guide the potential patient, the normal person, to choose correctly and to understand exactly what the real beauty is. Because otherwise it's difficult for people to make mistakes.
Absolutely. And I think, as you rightly mentioned, it's like TikTok world. We are living in TikTok world, Instagram, and all these filters. I think people want to look beautiful, but at the same time, having this artificial thing on their face and whatever. But do they feel good after doing this surgery, or again, it is a constant pressure of doing more, looking more beautiful every time?
Okay. It's important to realize that sometimes there is a real need to improve and to improve what nature has not to be so kind to you. So there are real cases where we need to help, we need to give back the beauty or the better aesthetic that has been lost with age, has been lost because of trauma, has been lost for a lot of things. So
or accidents.
These are the right cases. But what makes me sad sometimes is to see young girls, a young patient that they run towards this eternal beauty in a way because they see in the media, they see in the social media the stereotype of what can be beautiful, and they want to copy that. That is not really the good way to do, because you need to adapt to what you see, but to adapt to you. You are the individual. You are the person that needs to be improved. What can be good in one influencer may not be good for you. So you need to be able to understand this point. You must be able to realize that and to make the right decision. But again, what makes me sad that a lot of young girls, they don't see that, and they fell in the trap that they reach and they want to copy somebody else that sometimes is not good for them.
Absolutely, and they want to be in trend with the fashion, with the up market, and all this happens. So as a doctor, when such kind of patients approach you or approach any aesthetic doctor, plastic surgeon, what is the first thing as a guidance and or a self-assessment that you do?
First things, in my practice, in my experience, having spent more than 30 years in this industry and having dealt with a lot of patients in different parts of the world, different ethnicity, different ages, I learned that the starting point is for me to listen. I have to listen to the patient, let the patient talk, and for me to understand exactly what the patient wants, what is the expectation, what is good for her or him. So I listened, I see the patient, and then I make my conclusion and I give you my honest advice on what can be good and what can be realistic.
Wow. This is so beautiful, right? Like understanding the intention behind why they're approaching, right? And what is the second step? And do you see people see the difference when you give a clear, honest feedback to them?
Then the patient, yes, they have time to think and then make them think and realize that what I said is the right way. So they will understand that listen to the professional with experience is the right way to do. Like when you go to a lawyer or to the accountant, you don't know that. You listen to them. The same when you come to the plastic surgeon. You have to listen to the expert because sometimes just reading on Google, on ChatGPT, or hear from friends is not the same things.
And honestly, when we see these days Instagrams and other promotions that this particular sector is doing, it's quite lucrative. Like you get beautiful overnight with the surgery, you reduce 30 to 50 kgs overnight by doing certain surgery like liposuction and whatnot, right? So we as a consumer, I'm talking from the normal perspective, we as a consumer, definitely we fall for quick results, right? So, and at the same time, I think this sector is also making business because the need is there. So how to identify and how to differentiate whom to go, how to approach and see what is good or bad as a common man perspective?
This is a very, very, very important point, especially here in Dubai when there are too many clinics, too many surgeons. You're just driving some of the well-known street and roads and then you can see too many clinics.
True.
So I understand that the patient is in difficult position, where to go, who I have to believe. So this is a difficult part because the market here in Dubai is overcrowded. Too many, and when there are too many, there is the very good and the very bad. So we need to go to the right one. But for the patient, how to choose that? I believe that the best way is the old way. And the old way is the word of mouth. So ideally, a patient should talk with other patients that they have done the same treatment or similar treatments with a particular doctor, with a particular surgeon. They are happy, they be honest and telling the patient what was the recovery and how was the result. Because when you see too much publicity, very polished publicity in the social media with results that when I see also in Instagram some colleague that they put some before and after photo, this is not longer medicine surgery. This is like to sell a brand new car. So it's not the way that our profession should go. We must stay professional. We must stay in our ethics and give the best to our patient so the patient can have the best. That's why listen to the expert and go for towards word of mouth is important. And again, also the media have an important role in that because also the media can be the normal traditional media, can be social media. They have to inform the patient. They have to educate the patient with the right information. But of course, because of some lack of regulation, everybody can put something on Instagram, on social media, and show in photo that
transformation pictures
that they're not real, but that are misleading the patients. And that's what I try to make my patient understand when they come to surgery. What is the real expectation? Because at the end, if somebody does something correct, then the patient will benefit. There will be an improvement in the look and improvement in the confidence and the self-esteem.
Brilliant. I think what you said is being ethical in this industry is very important. And word of mouth, checking the credentials of the doctor, and very important. But how to find out when, there is also a price competitiveness in this, right? Like, so people want to look for people who are cheaper, right? I'm just thinking like cheaper and readily available and showcasing in social media and all. So what are the few credentials that we must validate? And also by taking into consideration the word of mouth and the feedback, because word of mouth is like whom to refer to, right? So when we approach, So the doctor should be giving referrals, or we should be looking out into website?
Okay, there are, the patient can look in the website, and in the website nowadays, there are a lot of information about the history and the credential and what the doctor, the surgeon did. So the patient can have already an idea. And then, of course, is the moment that the patient is facing the other person, the colleague, the doctor, the surgeon, and to have the feeling and they also make the right question in the terms, doctor, where did you study? Of course, we have to answer to this question. But at the end of the day, also the reputation is that if the doctor, the surgeon, is in business for many years with many patients, it means that there is something good there.
Yeah.
Okay? And then also to ask the right questions. And the right questions basically are, what is the treatment? What are the risks? What can be the result? The post-op, the expectation to have all the information. Whatever you do, a small thing or a bigger thing, patient has to be informed. And then you can get that if the surgeon, the doctor, is the right person that will give you the proper answer. Not just to make a quick sell, hiding what are the important aspects of the treatment. That's also the patient has to ask.
And the patient has all the right to ask these questions,
of course,
and to get an answer.
Exactly. We are there. That's our job. That's our profession. We need to give our advice. We need to give the information that the patient deserves, that the patient is expecting.
Yeah.
It's not just you come here because you want, for example, liposuction, and say, okay, we can do it. Let me see. Yes, you can do it. Go and book. No, that's not the way to do. We need to go through. That's why the proper consultation may last half an hour, may last 1 hour, because there are a lot of things to discuss.
Yeah,
okay?
Absolutely.
And that is the right way to understand, yes, I am in the right practice or not. The other point that is important to understand for the patient, that nowadays surgery is expensive, because everything you do in surgery, when you enter an operating theater, there are costs involved. Okay?
Yes.
If you use the right structure, the right place, the right hospital, the right instrument, the right equipment, there is a cost. So that's why sometimes patient may think, oh, it's expensive. But there is a reason. Because the cost involved the material, the equipment, the location.
And the quality.
And the quality and the expertise, the
Yes.
expertise of the surgeon. If you take a shortcut, okay, then you may have problems, because in taking shortcut, then you need to sacrifice the quality, you need to sacrifice the instrument, the adopt the wrong technique, and or maybe the surgeon did not train enough to do this particular operation, and training is expensive. So all of that goes to the final cost. That's why if the cost is too little, is too low, there is something wrong.
So yeah, absolutely. And I think there has to be a balance between cost, quality, and the expertise that is getting into, because this is something related to your body.
Correct.
Yeah. And coming back to the previous answer that you gave, like when you are seeing a trend, especially the young ladies and maybe boys are also coming to you for such kind of surgery or such kind of aesthetics treatment. Do you think, or have you experienced when they have come to you and after your counseling, they understood that, no, this is not the right age or this is not the right path, and they got convinced and they did not go step ahead with the surgery? Or if you explain them and then they switch to another doctor?
Yeah, sometimes that can happen because it might be the patient has a certain idea, and even if the surgeon tells us something different, they want to stick to that idea until they find the other colleague, the other surgeon that will do what they want. So that can happen, unfortunately.
Yeah. And usually because when they come with grief or because of some pressure that they are going through, this will be the attitude, right? And and the similar aspect, can you just give certain evidences where have you seen that with much required transformation, you have seen the boost in confidence they have?
Oh yes, I have a lot of cases where the patients did the right surgery, the right procedure after my advice, and then they feel confident. I change the life. They have a more confident, better self-esteem. And when I hear that from a patient, that is the best satisfaction in my job.
And any kind of best memories that you want to share, that what you have experienced in your past 30 years?
Oh, I have quite a lot. But there is one particular that happened a few months ago when I had an interesting case, a sad case, a different one that you don't see very often. But there was a young man that when he was younger, he had a motorbike accident, and the motorbike accident left a big trauma to one of his arm. Okay, so he cannot move properly the arm, and then because of that, the look of the hand and the forearm change compared to the other side. And so that gave to this patient a lot of psychological issue in terms of lack of self-confidence, self-esteem, because of that, always keeping the forearm and the hands covered. Then this patient came to me asking if I can do something. A difficult case, a not usual case. So what I did, and was the right things to do, is to do fat grafting. I do fat grafting, that means to take fat from one part of the body to another one since the early 90s, because I was lucky that I've been taught by the master, the father of this technique, Professor Pierre Fournier. So adopting this technique, I was able to reconstruct and give back the volume to the hands and to the forearm to match
to look equal
to the other side.
Symmetric.
Okay, was challenging, but at the end was very rewarding, because when I saw the patient after the surgery, after a couple of months, the patient comes back and say, "Doctor, thank you very much. You changed my life. I don't need to cover anymore my arm and my hands. I'm happy. It changed my life."
It's a beautiful story, right? Like where you see the self-confidence coming back, and he's so happy that he got his life back.
Exactly. That is our satisfaction.
Yeah.
Because when you do something that you love, that you like, that is what we would like to hear.
And what is that technique called? You mentioned this.
Was fat grafting.
Okay.
Yeah.
Okay. So because it's a similar story, and I was also riding a bike, and I have this long accident scar. So that can be used also, because see, even I'll tell you the story when my operation was about to happen, and orthopedic surgeon said that no, we have to operate your right arm, and then we have to put that plate. Yeah. My dad being a doctor, and his first question was, no, she's a girl and she will get married. I don't want any scar in her hand.
Yeah, you see, scars are part of our life.
Yes.
And when there is a scar, sometimes it's impossible to make a scar disappear. So we must learn also to live with scars.
Yeah.
So we need, as a surgeon, to do our best to minimize the scars, but scars will never disappear. And in your case, I think that it's just a nice fine line that does not
visible enough and
does not make any difference in your look.
Yes. Yeah. And this is how, when we recover from the scar, that tells us our story, our past. But also, if that can be minimized by experienced doctors like you, it gives a new birth by building confidence. Yeah.
Sometimes we see bad scars that can affect the patient psychologically, with self-esteem, self-confidence. So in that case, there are the few techniques to help to reduce the scar. But as I said before, the scar will never disappear. But we need to do our best to minimize as much as possible.
Yes, absolutely. And I think doctors like you are bringing magic to this and building up on the confidence. Yeah. Saying that now there is a rapid growth in the global aesthetic industry. So if globally we see, what is the volume in numbers?
Yeah. The market always increased Always. Since the beginning of my career, I can see a steady increase in the market. But I see the number of patients, of people asking for that, but I see also the number of doctors and surgeons increasing in the aesthetic field. And I think that in the last 10 years, we're reaching a sort of overcrowding in our specialties.
So much of doctors,
Yes.
and these are qualified doctors, or
See, that is also a good question because when you do medicine, you're qualified.
yeah,
You are a medical doctor, then you are a surgeon, you can be a general surgeon, you can be a maxillofacial surgeon, you can be a plastic surgeon, you can be an ENT, but you are a surgeon. But when you study, especially in the past, you study the main field of surgery. But when it comes to aesthetic surgery, aesthetic treatment, there is not a proper course at the university. Nowadays, in certain places there are, but it's not a common finding. So that's why if you enter in the aesthetic field, you need to learn. To learn how? In the past, you go and work with the other plastic surgeon that they do aesthetic, and you learn from them.
okay,
That's the way that I did. That's the way that was done in the past. But the number was smaller. Now the number is bigger. There are more surgeons, more doctors offering this sort of aesthetic treatment or aesthetic surgery, where they can learn that.
correct.
Because there is a limit how you can go person to person, colleague to colleague to learn like we used to do in the past.
Yes,
So nowadays, yes, you can go to congresses. You can go to the congress, you can see the technique, and then you can start. But you should do that when you did the proper training, not just to go to a congress, see something new, and go to your practice and try. I don't think that this is the right approach. That's why nowadays there are more new bodies, like academies that are recognized to give proper certified training in aesthetic medicine, in aesthetic surgery, where the colleague can go there, spend a few days with the expert, with the panels, learn from the cadaver dissection, try on the cadaver, then try and attend the operating theater with the expert, have a few days of training, certify the training, and then you can go back to your practice, and after that you can start. So there are now these sort of academies,
Accredited.
like for example one that I think that it's one of the top, it's called ECAMS, the European Academy for Aesthetic Medicine and Surgery, where they give a lot of good specialized trainings in aesthetic medicine and aesthetic surgery. So that's what we need to do to keep our knowledge up to date. Even, for example, a surgeon like me, after 30 years, there are new techniques. So we need to go to these bodies, to these academies, to do the proper course,
And upgrade.
to refresh and to upgrade our knowledge. Our profession needs a constant upgrading. And nowadays, having the possibility to do these training courses, also with the cadaver training, is the best way to keep our knowledge, to improve our knowledge, and to adopt new technique.
True, and to keep updated so that we with the latest technology and
Exactly.
everything. Yeah,
But like I said before, all of that has a cost. So that's why if you go to a clinic, you feel it is expensive, there is a reason why. If it's too cheap, then be careful.
yeah. Then there might be quacks sitting there and doing experimenting on your body,
Yeah.
right? Saying that, what are the latest innovations are there in this industry?
There are quite a few, like regenerative medicine, longevity, but also when it comes to this particular surgery, for example, to do new techniques for the face, try to hide as much as possible the scars for a facelift, and then also to do a proper body reshaping with ultrasound energy with liposuction, to use also radiofrequency technique to help the skin tightening after liposuction. So there are a lot of new technology that we adopt. And for example, one of my favorite new trend now is on breast augmentation. Okay, because everybody knows breast augmentation. You go on social media, you see these before and after that are amazing.
Yes,
okay?
amazing results.
Amazing, but are they real or not? That's the patient should ask that. But what is important, they focus mainly on the size, okay? The size of the new enlarged breast, okay?
Yeah.
But they never talk about the other important aspect, the weight.
Okay.
Because if you put a big implant, think you're putting there 500 grams or more of implant, and you will carry for 20, 30 years 1 kilo or half a kilo extra weight because of the implant.
True.
Nobody tells you that. If you go looking at the social media, you will never find, or very seldom will find somebody that is honest to tell you about this particular aspect.
Which is weight.
The weight of the implant. And also when I have patients that come to see me for breast augmentation, they don't think about the weight. But now, for me, this is the important aspect. Because there is on the market, finally, in the last few years, a particular implant that is lighter, has a 30% less weight than the traditional implants. Okay? So that is what is important. That's what I want to give to my patient, using the latest safe technology, well experimented, that give you a beautiful, natural breast, bigger, but with less weight. And then the patient will carry less weight. That's why in my practice, I like to use only this particular implant, okay, that has less weight, is lighter. More expensive? Yes, but there is a reason why.
Yes, and more convenient and also safe at the same time, right?
In fact, recently I had one patient that did a change of breast implants from a traditional implants with good size, with some weight. I convinced her, because it was the time to change it with the lighter one.
Okay.
First thing she said to me after the surgery, after 1 month that I saw her, doctor, I feel no weight, I feel much lighter. It's beautiful.
Wow.
So that is what is important. That's why
that comes from the expertise and, people who are up to the date. And
exactly, to update yourself and to use the right technique, the right technology, and be honest with the patient. So that's my approach, that's what I do. And that's an example why we need to update ourselves and to use the best material, the best equipment for the benefit of our patient. I think in the days where the surgeon, the doctor is here and the patient is here, those days have gone.
Yeah.
We are on the same level, but we are the expert and the patient should accept that the patient came to see us because wants the professional advice. But coming well informed is a nice discussion at the same level.
Yeah, and will this technique will also help or has helped the breast cancer survivors and do people who have breast cancer surgery? Because my mom is also a breast cancer survivor. So will that also help them?
Of course, because when they do breast reconstruction, they can use traditional technique with a skin muscle flap. They can use some fat grafting. They can use also implant. So in this case, to use a lighter implant, also there is a benefit.
Yeah.
And also think at a certain age, the breast goes down, okay, because of gravity and age. And there are patients that want to lift the breast, to do an uplift. But very often when you do an uplift, you need to give a little bit more extra volume, especially in the upper part of the breast, to give a better, more natural and better shape in a way that's also a little bit bigger. So in that case, it's advisable to use one lighter implant. That's why I'm using this lighter implant that will drag less the breast. I reposition in a higher position the breast. I want the breast to stay there. I don't want to put an implant and after a few years we'll bring it down again.
Yeah, yeah.
That's why, again, my advice, let's use what is the most advanced and the best product in the market, in my opinion, and that put them an implant that will have less weight.
Amazing. And I think that is how science has advanced, and we are getting updated with the latest technologies.
That's why I also put that in my social media, my Instagram account. I like to put that and to be more educational in terms of information to the patient. That's why I like to explain to the patient the importance of the weight in breast implants. Not only the volume, but now think about the weight.
And have you seen the trend increasing in this particular category? Because, people are looking for proper body shape and all that, right? So have you seen an increase in the demand for particular surgery of this?
Yes, there is the surgery for body reshaping in a way to have more definition, a more athletic figure, okay? And also, especially in the Gulf, also fat grafting to improve the contour of the hips and sometimes also to give more volume to the buttock. Okay. These are very common procedure as well.
And now people, we are staying in a state of mind of being natural, but also going for such kind of surgeries for enhancing the beauty.
Yeah.
Right. So is there any conflict, or actually this coexist with natural beauty and people are going more organic, more natural?
Okay. Again, depends on what you do. Because I agree with you, we should stay natural, but also sometimes you need surgery. If you need surgery, do something that will give you a more natural result, not a complete extreme transformation. I don't believe in transformation. I believe in enhance what the patient has, giving back the beauty that the patient had a few years ago without transforming, without changing the patient.
Yeah, true.
But sometimes I see in social media before and after photo of colleagues, or they do some facelift, and the patient looks like a different person after.
The complete identity is lost.
Exactly.
Yeah.
That's not what I want to give to my patient. I don't believe that we have to go to such an extreme transformation. We need to enhance in a natural way what the patient has to give back her young look, not a different look.
Yeah, not losing their own identity.
Correct.
Yeah. So how we manage these three different parameters, which are very critical. One is enhancing beauty, as you said, enhancing beauty. At the same time, managing your internal satisfaction or internal contentment, that staying up to the mark and all. And third is also being natural and being authentic.
Okay. First of all, the patient should have time to think. Time to think what the patient wants and what she really would like to have. When the patient has this idea in the mind, that's the time to see and to find the right surgeon, the right doctor that can give her that.
Guidance.
With the right guidance, but the patient, when is during the consultation with the surgeon, has to give to the doctor, to the surgeon, the right information, exactly what she has in mind, what she wants or he wants, okay? So that the doctor, the surgeon can understand exactly what is needed to reach this goal. That's why what I said at the beginning, the first thing we need to do is to listen.
Yeah.
We need to listen to the patient. We don't have to impose our will to them. Yes, we need to give our professional advice, yes.
Yeah.
But first listen, and then you, as a professional, find the right technique, the right way to deliver what the patient wants in the right way. Sometimes patients have unrealistic expectations. They may want something that is not good for them. Then it's our duty to say no. Sometimes we need to say no, and we need to say you need something different, or you may not need anything.
Beautiful. And putting them back to track on what is actually needed.
Yeah.
Yeah. And not expecting for magic happening overnight.
Exactly.
Yeah. And
So, but For all of that, we as a surgeons, we need to think that what we do is a service, is not just a business.
Absolutely, and that
We are first medical doctors that we serve the patient to give back to the patient a younger, better look to improve the self-esteem, the self-confidence, and at the end to improve quality of life. We don't save life, but we need to improve the quality of life.
beautiful. This is actually in one statement itself, like how aesthetic industry is serving for the benefit.
Correct.
Like not changing someone's identity, but changing the quality of life, right?
And after 30 years, I love what I do because I believe in that, and I keep this principle, this ethic with me, with every patient. That's why I keep working in this field.
And I think at this point of time, our community, our world needs more doctors like you. And you have seen a massive trend in those days, and these trends have been changing, right, as you said, with the growth. What is the good trend and bad trend you have seen in this industry now?
The growth is steady, and that will keep going on. If I may go back to a slightly different point, what I see that a lot of, quite a few colleagues, surgeons, they behave like if they're stars, like they're prima donna. And that I think that is not correct. Because we are surgeons, as I said before, to serve the patient. We don't want to be stars, become like a star. If you want to be a star, go and do something different, enter a different profession.
Okay, yeah. Not to act as stars or magicians,
Exactly.
right? Yeah, okay. And what is one of the best trend that you have seen in past few years?
The trend that I see that nowadays there are more patients that they come to the consultation with the right information. Okay? There are patients still with the wrong information, a wrong expectation, but I see now more patients coming well informed because, luckily for me, in my practice, I have a patient that made the right research, okay, nowadays in artificial intelligence
ChatGPT,
or in Google,
yeah.
asking the right things and get the right information so that they come to me well informed, and so we can have a proper discussion on what is possible to do, and the patient understand my language, understand what I'm telling to the patient because they're well informed. So that I think it is a positive aspect in this new trend that there are also patients better informed when they come to consultation. And that's thanks to some media, thanks to the artificial intelligence or Google, whatever you want, but to get the right information.
And with improved awareness, right? So the journey becomes very partnering rather than one-sided, right?
Exactly.
So this is the trend that
I think that the days where the surgeon, the doctor is here and the patient is here, those days have gone.
Yeah.
We are on the same level, but we are the expert, and the patient should accept that the patient came to see us because wants the professional advice. But coming well informed is a nice discussion at the same level.
And that eases your job, right? Like
Yes,
it eases the understanding and the first partnership thing that you build on trust. Saying that, is there any gender specific, like women are more inclined to this and men are not, or you have seen a change in the trend in past few years?
No, gender doesn't make a big difference, no. The only difference that ladies, women, the main age that is comfort, they pay much better than men.
Okay. But you think there is an increase in the demand from both the genders? Men are equally becoming...
Yeah, I see an increase in men asking for surgery because they want to have a better look in terms of body, but especially also in terms of surgery for the face. Because I see that there is more demand, for example, for eyelid surgery.
Oh.
Yeah, because they want to have a less tired look with heavy eyelid, big bags there, So that's why this is a trend. I can see more men asking for eyelid surgery, and the other increasing is in the treatment for gynecomastia. More men are coming to correct the men boobs, gynecomastia, when the chest has too much fat or too much glandular tissue, okay? So they want to have a better chest, more masculine, and removing this excess of fat and glandular tissue. It's called gynecomastia. So there is the surgical technique to correct that. And that is a steady increase in that, yeah.
Oh, wow. And do you see any kind of good, proper regulatory frameworks coming, as you said, because there is lack of regulation in this particular surgeries industry and aesthetic industry? Do you foresee any kind of framework upcoming which will actually regulate this industry?
Yes, I have to say that now Dubai is well regulated. Dubai Health Authority is doing a great job in implementing regulation in hospital, in clinics. So if you go to a clinic hospital that is regulated by Dubai Health Authority, you are in a safe place, okay? So
Brilliant.
the problem when there are some doctors or surgeon visiting, working in not the proper places, that is always a risk,
Okay.
or working below the radar. But if you go to a proper accredited clinic, hospital, and all of us, we are accredited, especially if the surgeon that you use is a member of the Emirati Plastic Surgery Society, that is a guarantee.
Okay.
And our society is big, is well regulated, there are regular courses, regular meetings, so we work for the benefit of the patients. And nowadays also, they will start with new regulation in the big field of regenerative medicine and longevity, the use of stem cells. Before was pretty unregulated. Now, in the near future, will be much more regulated. And I'm proud that I am in Dubai, where the authorities are doing a good job to give a proper regulation in this important field that has to be regulated.
And which is the upcoming future, right? Longevity,
Yeah.
and everything is the next future we are talking
correct,
about. And Dubai is very much regulated. And which part of the world is not at all regulated, so that our audience can make sure?
That's an embarrassing question.
Okay.
There are some countries that are very popular, that are not so regulated, and they're cheap. So there are.
So we should avoid that
Yes.
from visiting.
I don't want to mention any country, but yeah, there are. Yes.
There are, yes. And as you said, we should be very much aware about who we're visiting, who will be doing the surgery, and that's very important.
Yeah.
So, nice. And last question before we sign off. What is that one message that you want to give to all the doctors that they are getting into the sector, aspiring doctors, and also all the common men like us who are looking for doing any kind of aesthetic enhancement?
Good. To the new doctors, I like to tell them, enter this field with passion, with honesty, with ethics, and learn from senior colleagues that have a lot of experience on that. Be humble at the beginning. Don't be afraid to ask, but try only when you did the proper training. And then you will start your journey in this beautiful field in a safe way, and you will have lots of happy patients. Don't think only to business and make money in a short period of time. Think about your reputation, your knowledge, your skill, and how to improve them and to keep always them updated. For the patients, make your own research, and when you go to the doctor, to the surgeon, be honest, say everything that you have in mind, okay? The real expectation, exactly what you want, and if you don't understand something that the doctor or the surgeon tells you, don't be afraid to ask again, please, I don't understand, can you explain better? Do that. When there is a clear, good, transparent communication, this is the key of the success.
And I think this is one of the very important message to both the parties, and where both the parties are equally responsible,
Yeah.
right, for taking it forward. Not only the doctors, but also the patients at the same side. Saying that, last question to you: what was definition of beauty when you started your career? What is the definition of beauty today?
Beauty is harmony. Beauty is harmony. Beauty comes from the outside, but beauty comes also from the inside. So it's not only a beautiful envelope, but is what there is inside that beautiful envelope.
I think one of the best definition of beauty we had, like what is inside, it is also equally important.
Yes, correct.
And thank you so much. It was
thank
such
you.
a insightful discussion with all the aspects, and covering from what is aesthetic industry, what are do's and don'ts, and the innovations mostly, what actually helps. And what is most important is having a trade-off between quality, cost, and also experience at the same side.
Yeah, it was a very enjoyable discussion, and thank you for letting me explain my way of thinking.
Thank you so much.
Thank you.
Pleasure having you.
My pleasure to be here.
Thank you.
If you want to know more about me, you can have a look at my website, that is drrobertoviel.com, and there you will have all my biography, my history, and what I do and where I work. And then you can see social media. My favorite social media is Instagram. I have my account, Dr. Roberto Viel, on Instagram, where is mainly a professional, educational account where I say what I do, and I want to give information and to educate the audience. So that is the way where you can have information about me. You can find me in Dubai, in London, Abu Dhabi, and also in Dublin.
If this story moved you, don't just scroll. Share it, start a conversation, and subscribe to be part of something that redefines what it means to grow. And if you have an inspiring story, please get in contact with her team, info@reengineeringclub.com.